and welcome back to the Harmonize Your Hormones podcast, where we have real, authentic conversations about navigating our hormones and our health from a functional medicine and integrative approach. I am your host, Dr. Danielle Lewis, naturopathic doctor, women's health expert, and advocate for helping you feel empowered in your own body. And since it's October, you already know what that means. It's Breast Cancer Awareness Month, or as I like to call it, Breast Health Awareness Month, because in functional medicine, we like to take the preventative approach to our health. Now, awareness is a wonderful start, but I want us to go beyond the pink ribbons. So today, we are talking about how to take charge of our breast health, from self breast exams to mammograms and even natural ways to support healthy breast tissue through lifestyle, nutrition, and appropriate supplementation. So let's get started. Here's the reality: 1 in 8 women will be diagnosed with breast cancer in her lifetime. But when it's detected early, survival rates are over 90%. So that's very promising. So this month, I want to encourage you to not just wear pink, but to take real proactive steps around your health. And if you're listening and you're thinking, I'm too busy or I'll get around to it next year, this is your gentle reminder. Your health deserves to be on your to-do list. One of the simplest and most powerful tools you have is your own awareness about your body. So that brings us to the subject of self breast exams. When I'm performing clinical breast exams on my patients, a lot of times there's a lot of anxiety around performing self breast exams because my patients aren't quite sure about what they're feeling. They get freaked out. Every lump feels like something's wrong. And so for some people, knowledge isn't power, isn't power. Ignorance is bliss. And I'm here to tell you that it's important for you to advocate that when you're having your clinical breast exam, that your practitioner actually take the time to educate you on what your normal breast tissue feels like, so that removes a lot of the anxiety around actually doing self breast exams. Because I have had occasions where patients, like, you're the first person to actually feel something, and then you go in and have a diagnostic mammogram completed and it's caught early because of that. And so doing a self breast exam once a month helps you understand what's normal for you. If you're a menstruating person, you want to make sure you're performing that breast exam 1 to 2 weeks after you start bleeding. This is when you have the least amount of hormonal changes occurring in the breast tissue. If you are perimenopause, menopausal, or you're on some type of birth control where you do not have a menstrual cycle, then I suggest just picking once a month. Like, my birthday's on the 20th, November 20th. And so I would say the 20th of every month, I would perform a breast exam just because it's an easy day to remember. Or the first, because that's when some people get paid. So like that could possibly be another good time, as long as it's a date that you actually remember. You want to remember that none of us are symmetrical. And so you might have differences from one breast to the other breast. Also, not every lump or bump means something is wrong. Our breast tissue is naturally lumpy bumpy. So for the most part, as long as what you're feeling is bouncy, kind of has a bouncy texture, similar to if you were to press the tip of your nose, it kind of bounces like that. It moves freely in the tissue. I'm actually less concerned if it's painful versus painless, but a lot of times that breast tissue can be more painful during your menstrual cycle or right before, which is why that's when you do not want to be performing your self breast exams. And if you ever feel an area that you're just not sure about, then please advocate for yourself and schedule an appointment with your healthcare practitioner so that they can analyze that lump and send you for proper testing for that. Now let's talk about screenings, because this is where a lot of women get stuck. Some skip mammograms because they're uncomfortable, Are they not having any symptoms? Do they just forget to schedule it? But we want to make sure that we are performing our screening mammograms. And so, if you're up to date with your women's exams, your practitioner should be sending you for screening mammograms. Now they have changed the age for screening mammograms from the age of 50. It used to be, then it was 45. Now it's 40. So you want to make sure that you're starting your screening mammograms at the age of 40, regardless of personal or family history. Some of you may be starting them earlier, depending on family history. But in this discussion, we're talking about general screening, and that should be started at the age of 40. Now, I know a lot of women have fear around getting mammograms. I personally have had several of them, and I was very apprehensive, even as a physician in the beginning. And they are not as bad as people crack them up to be. They are not flattening your breast tissue down to a pancake. The machinery has actually come a very long way, and the practitioners, that at least the ones I have dealt with, have been very female focused and understand that nobody wants to be there having this examination done. And so they handle you and your breast tissue with gentle gloves. They perform the exam. You literally have pressure on the breast tissue for less than 5 seconds for them to take their pictures, and then it automatically releases the pressure. And so hopefully that decreases some of your apprehension around having your mammograms performed. If you know that you have dense breast tissue, or your exam comes back and it says that you have dense breast tissue, which is actually a lot of minority women do have dense breast tissue, then you want to advocate and ask your doctor if it's appropriate for you to actually have a breast MRI and or an ultrasound in order to evaluate that tissue further, to make sure that they're getting a more thorough exam of that tissue and find things that maybe the mammogram could possibly miss. So your breast health isn't just about avoiding disease, it's about creating the right internal environment for your body to thrive. And so, as far as empowerment, we want to empower you as far as owning your health journey. This means knowing your body, asking questions, refusing to dismiss symptoms or concerns. If it's something that doesn't feel right, you need to speak up. You need to advocate for yourself. If somebody's looking at you telling you that your symptoms are normal and you feel otherwise, then you need to continue to have that conversation with your healthcare practitioner until they help you to understand why it's normal and they put your mind at ease. So, Black women, for instance, also are more likely to be diagnosed at a later stage and have higher rates of mortality. Part of the empowerment means breaking down these barriers, making sure every woman has access to care, because a lot of times minorities do not have the same access to care as our Caucasian counterparts do. And so it's very important that we are having these discussions with each other. You guys are sharing this podcast. Because if we don't talk about it, then we're just kind of really sitting around in our own head and not really taking the action and maybe talking ourselves out of our screening and doing self breast exams. I was actually just visiting a friend a couple of weeks ago, and I was very proud of her because she had written in her shower. She's one of those people that has notes kind of all over her house, and written in her shower, she had check your boobs. And I was like, yes, yes, yes. I think I actually even posted on my social media. I was like, I always love when my friends listen to me. So this is also a great thing. But we want to be encouraging each other to schedule our screenings, because knowledge is power and awareness spreads through the community. And as women, we can support other women and rise up together. So, my action items for you are, if you have not yet done so this year and you know you're due, schedule your mammogram or or at least your breast exam, breast screening during your Well Women's exam. I want you to do your monthly self breast exam. There's a resource that I like on, I think they're on most social medias, but I follow them on Instagram. It's called Know Your Lemons, and their main goal is to educate women about self breast exam and what's normal and abnormal, and so that women can advocate for themselves around this. And so I want you to find your resources. If you're going in for your Well Women's exam, making sure that they're educating you, your practitioner is educating you on what your normal breast tissue feels like. And I want you to start doing your monthly self breast exams. I want you to share this episode with another woman who can use this reminder. So those are your action items. If you want to learn more about natural ways to support healthy hormones and breast tissue, then you can head over to my website. It's harmony.care. That's harmony.care, where you can find my latest blog. And I have a couple of other blogs on breast health. But my latest blog is Beyond Mammograms, Natural Ways to Support Breast Health. Has a lot of really good tips in there around like lifestyle things that you can do, healthy tips for our proper supplementation, especially, and just a lot of these key awareness pieces that I'm talking about in this podcast. Also, before I go, I also just want to talk a little bit about what are those more integrative functional medicine, naturopathic things that we can be doing to support healthy breast, because that's what we're all about in this community. And some of the supplements, and of course, this is not me giving you medical advice. You always want to make sure you're discussing this with your practitioner. But some of my favorite ones are vitamin D and K2 to help with decreasing inflammation and just how your body absorbs calcium. It's also good for bone health, immune health, all of those things. Omega 3s are super. So like a fish oil, if you're vegan, there's other non-fish omega 3s that you can also implement in your supplementation that are very anti-inflammatory. So from some of you that do have more fibrous, tender breast tissue, not meaning you have breast cancer, but just more tender breast, that can be beneficial for decreasing inflammation. Exercise goes a long way, making sure you're moving your body, you're having proper circulation. Sleep is when we heal. So getting a good night's sleep, a good 7 to 8 hours of sleep at night is really important for resetting our immune function. And then supporting detox pathways. So some herbs that are helpful for supporting detox pathways specific for breast health are green tea supplements. The constituents that are in green tea are super anti-inflammatory and help. For some of you where you kind of have too much estrogen, estrogen's kind of wreaking havoc on your body. We call it estrogen dominance in the functional medicine and naturopathic medicine world. And you need to clear or support how your body detoxes healthy estrogens. I like DEM, which is basically concentrated cruciferous vegetables that support how your body metabolizes your hormones through your liver. And then endocarbonyl 3. On most herbs, it's called I3C, is what they call it, or IC3. I forget which direction it's in, but those can be very beneficial for helping with clearing some of those excess estrogens, which can also be more pro-inflammatory versus anti-inflammatory. And so if you're a part of my community already, my Fullscript community, where I offer supplementation, you can check out my breast health favorites. It's listed within that community where I have specific brands of the supplements listed there, plus a little bit more information about their benefits, and see if those may be something you need to add to your repertoire. If you want more one-on-one support from me, I am practicing both virtually in the states of Arizona, DC, and Maryland. And I'm also seeing patients in person in in Arizona. And so I do offer virtual free 15-minute consultations. And so if you would like to see if you're a good fit for me and my practice, and if I'm a good fit for you also, then please go to the website and you can easily request an appointment there. So until next time, ladies, stay empowered, stay balanced, and keep harmonizing your hormones.